Hello, today I'm going to present to you a topic of growing concern. STIs, formerly called sexually transmitted diseases, are a major worldwide problem affecting millions of people. Chlamydia is considered to be the most common bacterial STI. We will go over the epidemiology and pathology of the infection and then evaluate it using the nursing process. The presentation will conclude with how this critical information will affect nursing practice as a whole and my own personal practice. In 2018, the CDC reported 1,758,668 cases of chlamydia. This was a 19% increase since the year 2014. Unfortunately, this number is likely to be higher due to the unreported cases. To the left is a graphic created by the CDC representing the number of reported cases in 2018. The states in dark blue represent the most number of reported cases, whereas the yellow represents the least. If you can see, Alaska had the highest number of cases reported. As stated previously, chlamydia is the most frequently reported bacterial STI. The CDC also reports that the infection most commonly occurs in young adults. Almost 2/3 of new chlamydia infections occur among 15 to 24-year-olds. It is also estimated that 1 in 20 sexually active young women aged 14 to 24 years has chlamydia. Chlamydia is transmitted through sexual contact with the penis, vagina, mouth, or anus of an infected partner. It is important to note that during sexual activity, ejaculation does not have to occur for it to be transmitted. Additionally, chlamydia can be spread perinatally from an untreated mother to her baby during childbirth. The infectious process is a bit tricky, so bear with me. First and foremost, a chlamydia organism relies on the nutrients of its host cell, meaning it must live inside the host it infects to reproduce and survive. When the organism enters the body, it begins as an elementary body. An elementary body is metabolically inactivated until it enters the inside of a cell. The process of infection begins when it enters a white blood cell or an epithelial cell. It gets inside of the cell because the host cell is attempting to perform phagocytosis, or engulfing the chlamydia organism. Unfortunately, this is just what the organism needs to survive. The nutrients within the host cell are used by the foreign invader and develop into an active reticulate body. The reticulate body reproduces itself with binary fission, which is basically where the organism will split in half. It will then also begin to make more elementary bodies, which again are the inactive infective organisms. Once enough reticulate and elementary bodies have been produced, the hosts will eventually lyse, or burst open, and allow the chlamydia contents to be released. The cycle repeats and invades more and more cells. So now onto the nursing process. Assessment is the first step. Chlamydia is known as a silent infection. Because most infected people are asymptomatic, there is a lack of classic physical examination findings. Surveys estimate that only about 10% of men and between 5 and 30% of women with laboratory-confirmed chlamydial infections will develop symptoms. If symptoms do occur, they may not appear until several weeks after exposure. In women, if the bacteria infects the cervix, it may cause signs of cervictis, including things such as endocervical discharge and easily induced bleeding. Sometimes the urethra may become inflamed and cause things such as pyuria, dysuria, and urinary frequency. If left untreated, the infection can spread from the cervix to the upper reproductive tract, causing pelvic inflammatory disease, or PID. On the other hand, men who are symptomatic may present with urethritis, urethral discharge, and dysuria. A minority of infected men develop epididymitis, which may present with unilateral testicular pain, tenderness, and swelling. Furthermore, chlamydia can infect the rectum in both men and women, either directly or as a result of a spreading infection. This can cause symptoms of proctitis, which can include rectal pain, discharge, and/or bleeding. Chlamydial conjunctivitis can potentially occur as well. Both men and women are susceptible to this through the contact with infected genital secretions. In pregnant women, untreated chlamydia can be associated with preterm delivery. It can also be spread from mother to child during childbirth, called prenatal transmission. So, chlamydia basically poses the largest risk to the fetus if the infection goes untreated. The best way to prevent passing chlamydia to a newborn is to clear any infection before birth. This is why first and third trimester screenings are so important. If it is not treated before birth, conjunctivitis and pneumonia are potential complications. According to the American Pregnancy Association, there were studies where chlamydial conjunctivitis has been identified in 18 to 44%, and chlamydial pneumonia in 3 to 16% of infants. So now let's move on to diagnosing chlamydia. There are several diagnostic tests for this STI. This includes nucleic acid amplification tests, NAATS, cell cultures, and others such as gram staining. NAATs are the most sensitive tests of them all. Compared to cultures, they are both more sensitive and more specific for the detection of chlamydia. This means that it is less likely to have false negatives. NAATs do require specimens such as vaginal swabs or urine, which can either be clinician or patient collected. According to the CDC, vaginal swabs are optimal specimens in women, and urine is optimal for men. Once a sample is taken, the chlamydia's DNA is replicated using polymerase chain reactions. This is a quick process, which is why, in addition to it being more sensitive, NAATs are the most common diagnostic tests. But let's not forget about cultures. Cultures are still used and are beneficial for treating chlamydia. When a sample is swabbed on a petri dish, the organism is allowed to grow for a couple of days. It is because colonies do take several days to grow that cultures are not used for diagnostics. However, again, they are still useful. Cultures can be used to determine which antibiotic works best to kill that specimen. This is what we refer to as culture and sensitivity testing. So who should be tested for chlamydia? Any sexually active person can be infected. Even though we know chlamydia is typically asymptomatic, anyone who does experience genital symptoms like discharge, burning during urination, etc., should be tested. An important side note here to mention is that anyone experiencing symptoms like this should refrain from having sex until they are able to see a healthcare provider. Lastly, anyone with an oral, anal, or vaginal sex partner who has recently been diagnosed with an STI should be evaluated as well. Screening individuals is considered a secondary prevention method. It is used to detect chlamydia before it causes any damaging effects. Because chlamydia is usually asymptomatic, screening is very important in this regard. According to the CDC, screening programs have been demonstrated to reduce rates of adverse conditions in women. The CDC also recommends chlamydia screenings for several groups of people. First, screenings should be done yearly for all sexually active women under the age of 25. Women older than 25 with risk factors like new or multiple partners should be screened too. Anyone who has a sex partner with sexually transmitted infection, pregnant women under the age of 25, or older pregnant women with increased risk. These women should be screened during their first prenatal visit and again during their third trimester. Screening and treating chlamydia in pregnant women is the best way to prevent neonatal chlamydial diseases. While routine screening is not recommended for men, it should be considered in areas that have high prevalence rates. Additionally, sexually active men who participate in insertive or receptive sex with men should be screened annually. Lastly, providers should test all sexually active persons with HIV infection and at least annually during the course of their HIV care. Bear in mind that all of these are only recommendations. Individuals should talk to their healthcare provider to determine if they need more frequently testing. So what is the treatment for chlamydia? Chlamydia can be easily cured with antibiotics. As previously stated, culture and sensitivity tests can be used to determine which antibiotics works best. Some of the common antibiotics used include azithromycin, doxycycline, and amoxicillin. Anyone with chlamydia infections should abstain from sexual activity for 7 days. This is to prevent spreading of the infection to others. Just like any medication, though, adherence is key. It is important to take the full course of prescribed antibiotics to fully cure the infection. The most common side effects include GI pain, nausea and diarrhea, and vaginal thrush in women. Unfortunately, though, antibiotics cannot cure any permanent damage chlamydia may have done to the body. Repeat infections with chlamydia are common. Having multiple chlamydial infection increases a woman's risk of serious reproductive health complications. Both men and women with chlamydia should be retested 3 months after treatment of an initial infection. For partners, if a person has been diagnosed or treated for chlamydia, he or she will need to tell all recent anal, vaginal, or oral sex partners. This allows partners to seek treatment and reduce the risk of developing complication. Depending on the state, healthcare providers may give their patients extra medicine or prescriptions so they can give it to their partners. This is sometimes referred to as EPT, or expedited partner therapy. The CDC found that clinical trials that EPT is associated with fewer persistent or recurrent infections and has resulted in a large number of partners being treated. Even though they may receive medications, partners should still seek medical evaluation. Treatment for pregnant women is similar to non-pregnant women. Antibiotics. The antibiotics used in pregnancy are typically safe. The CDC suggests that pregnant women who are treated should be retested at 3 weeks and 3 months post-treatment. Neonates will also receive antibiotic treatment. As we discussed earlier, neonates contract chlamydial conjunctivitis and/or pneumonia. The World Health Organization, commonly called the WHO, recommends that for ocular prophylaxis, the following topical antibiotics be applied to both eyes immediately after birth: tetracycline, erythromycin, providine iodine, and silver nitrate solution. More than 95% of people will be cured if they take their antibiotics correctly. Depending on the circumstances, individuals may or may not need to go back for evaluation right away. However, individuals will need to go back for follow-up testing if they have had sex before they or their partner finished treatment, they forgot to take the medication or didn't take it properly, their symptoms didn't go away, and if they are pregnant. Individuals under 25 years of age should be offered a repeat test 3 months after finishing treatment because they are at higher risk of getting infected again. Pregnant women with chlamydial infections should be retested 3 weeks and 3 months after completion of recommended therapy. Individuals with chlamydia need to be evaluated for potential complications. Chlamydial infections can lead to serious health problems for both short-term and long-term consequences. In women, untreated chlamydia can spread to the reproductive tract and eventually cause PID. According to the CDC, symptomatic PID occurs in about 10 to 15% of women with untreated chlamydia. PID can cause permanent damage to the fallopian tubes, uterus, and surrounding tissues. This damage can lead to chronic pelvic pain, tubal factor infertility, and potentially fatal ectopic pregnancies. Some patients with chlamydial PID develop Fitzhugh-Curtis syndrome. This is inflammation of the liver capsule and the surrounding peritoneum. Lastly, reactive arthritis can occur in both men and women following chlamydial infections. Sometimes this can be a triad of symptoms. The additional symptoms may be arthritis and conjunctivitis. Moving forward, nurses play an essential role in STI prevention and treatment. They are in a unique position to be able to interact with individuals of all ages. Nurses can help decrease the number of chlamydia infections through advocacy and education. From delivering preventative education to administering STI testing and treatment, there is a wide variety of steps nurses can take to combat the growing prevalence of STIs. One thing that I find rather important for my own practice is confidentiality. Confidential care is crucial because it establishes trust between patient and provider. Not remaining confidential can create a barrier between this relationship and potentially discourage individuals from seeking care. In addition to confidentiality, prevention is a vital component to decreasing STIs. Shown here is a great infographic from the CDC. Staying healthy and STI-free is possible through several strategies. And that concludes our discussion on